So in this video, I want to explain some of the things that I feel that makes our practice unique or different from some of the other practices out there in regards to just caring for your shoulder. So for starters, I think volume and experience. We do a very high volume of these procedures, over 600 surgeries a year on average, and 80 to 90% of those are in the shoulder specifically. So I've performed thousands of surgeries, like over 3,000 surgeries at this point in my career, and the vast majority of them are shoulder. And with anything in life, with repetition and time, you develop more skill and expertise. And so with that being said, I think that specialization and that high volume have allowed us to really fine tune our practice and become excellent at shoulder surgery. In terms of my background, I was trained by who is highly regarded as the best shoulder surgeon in the entire world. His name was Gilles Walsh, and the fellowship I did with him was in Lyon, France. Now, he recently retired, but before he retired, he was considered to be the premier, or at least on a very, very short list. If you asked most orthopedic surgeons who was the best shoulder surgeon in the world, his name would be at the top of the vast majority of lists, because he was just a phenomenal surgeon. And I've taken all the skills and things that he taught me and the principles and applied in my career, and hopefully have continued to elevate the shoulder care that we deliver our patients. And I'm just so thankful that I had the chance to spend time with him, because he really was a special person. We utilize a lot of cutting edge technology in our practice. I think that, with all the problems that we have in healthcare and things that we need to get better, technology and innovation are going to help solve a ton of the problems if applied in the correct way. So specifically for shoulder replacements, we utilize 3D printed guides and computer assisted surgery, where we get a scan of your shoulder and I sit down and I really do the whole operation on the computer, and I check the motion and I check the position of the implant, and I'm doing a lot of things that I used to have to do intraoperatively I can do on the front end. And what this allows for is extremely accurate and precise surgery that's minimally invasive and bone sparing, and most importantly, improves the efficiency of the operation massively. The average shoulder surgeon or the average shoulder replacement surgery takes over 2 hours. We do it in less than 30 minutes. We do it in less than 30 minutes on average. And there's multiple factors that go into that. The technology, right? So being able to utilize this technology, the volume that we do, and having an amazing team of people, right? So if you do a high volume, you have an amazing team, and you utilize all the best technologies, we've been able to shave that time down to a fourth of what the standard shoulder replacement is, which is great, because the shorter your surgery time, the lower your risks of anesthesia, right? So the less time you spend under anesthesia, the better on your body, the fewer risks that something is going to happen, the lower your infection rates. And we've actually found that you have less pain. So patients that undergo surgical times that are shorter have less pain than longer surgical times. And there could be a multitude of reasons for that, but the fact remains that the quicker the operation, the less pain you have. So we always strive to get that, and we are very, very consistently under 30 minutes, honestly. Another thing that makes us unique is that we record all of our outcomes. We have all of our data. So, when patients come in, they see us, and they have an operation, they're tracked from before the surgery till years afterwards. So we can look and we can tell patients, what are our success rates? And for all of our shoulder surgeries, the success rates are 98% across the board, right? Meaning 98% of the patients are very happy. Their pain is way less than it was, their function is way higher, and they're very, very pleased with their shoulder. And so you can't really get that accurate data unless you track your outcomes. And we've been doing that for years, and that's something that makes us unique among a lot of orthopedic surgeons don't track their outcomes. Another thing that we do now is we record all of our shoulder arthroscopies, start to finish, with a live video, and that I really use that. With my background being a football player, every football player, when you come in the day after the game, or 2 days after the game, what do? You watch game film. Why do you watch game film? Because you want to get better. So it's really difficult to really analyze what happened in the game if you don't have game film. So we spent hours and hours and hours watching game film, to prepare for our opponents, and also to analyze what happened the day after. So it's, I use that in my practice. I use these arthroscopic videos as game film, and I use them to analyze what happened, how do we get better, and then also utilize them to plan for future operations. And it's precious data, and unfortunately the majority of surgeons are not utilizing that technology that's out there, but we've been doing it for several years now. Other things that we offer are, cutting edge biologic augmentations after the operations in order to decrease your pain and increase your healing time. So these are different biologic substances that are similar to stem cells. It has all the things that stem cells have in them, and it's typically from amniotic tissue from the placenta. And that stuff can really, really decrease your pain and speed up your healing times. And there's plenty of evidence behind that. After surgery, we use a multimodal pain approach with that really. The majority of our patients take minimal to no narcotics after surgery. It's rare for us to have someone still taking pain pills 2 weeks after surgery, the strong pain pills. I think that's because of our minimally invasive techniques we use, the efficiency that our operations are done in, and also by using all those different medications that are not narcotics to treat your pain, that have way fewer side effects, we can really minimize that narcotic use. So it's rare for us to have someone actually be on narcotics more than 2 weeks, and the vast majority of our patients take minimal to no narcotics. After surgery, something unique that we provide is virtual PT. So I think a lot of patients are concerned about the rehab and the time and the energy that's going to go into getting their shoulder. Not only do you have to take take the time to go have the operation, well, now you've got to go rehab it. We have a really, really innovative system where you can now do all of your therapy from home, right? And it's an excellent system, it's cost effective, and the outcomes are excellent from it. So you can do all the therapy after your surgery from the comfort of your own home. So this is, a short list of the things that I think make our practice unique, and I think all the reasons why we would love for you to come see us if you're having trouble with your shoulder.